when we try to prevent the diabetes, when you tackle the patient diabetes the best way so that they have a normal expectancy. If my expectancy is, I don't know, any expectancy, so any patient of diabetes already diagnosed, let us see how best the person can live the life. We should not just tell him that okay, you have diabetes, all those complications happens, you in a matter of years you are going to lose the things, your liver or kidney or heart or they also get affected. No. We as a medical fraternity, we all of us educate the patient how to, when the patient of diabetes comes to us, let us educate how best we can lead normal expectancy with the diabetes alone, how best we can manage, how best we can live the life. That's what the people wants. And second, the administration or the system wants that how we can prevent the diabetes in the world. We all of us here are around 100. So 100 people can, each individual, if you can educate some 10 to 15 people around you, then how we prevent the diabetes. How, okay, if diabetes, how can treat better? How can it better? So with that, this thing, diabetes as such or whether some interest about the diabetes because it is decreasing, but we are not stressing on the prevention. As an individual try to do that, let us try to do that as an individual, let us educate our own people, our own family members, our own relations. Let us try to educate them why diabetes is increasing. Don't be happy that there is kidney specialist, don't be happy that cardiologist says that we have good renal transplant, we have good dialysis, we have good nephrologist, we have good neurologist, then they develop stroke. Don't be happy with that. Understood? We should see that the person after diagnosis should not land in complications. Then you are wiser. You are not wiser. If your own patient of diabetes land in complications, that means you are not wiser. You are not wiser in the management. So let us become wiser in the management, in the approach, in the communication, in counseling. One is prevention of diabetes, second is when the patient diabetes, educate him about that. Reconsole him that okay, don't do with diabetes, it's a simple disease, well managed, they have a normal expectancy. So that's what important. So you look at that again, it's simply what is diabetes, you understand that it is just a high blood sugar, that's it. Why we are worried about high blood sugar? Why should not be worried? Why you should treat that? Because high blood sugar is going to damage one thing we remember. At the end of the day, diabetes is going to damage vascular system. It is going to is at the end of the day, one word to remember, diabetes uncontrolled. Not uncontrolled. Diabetes uncontrolled is going to damage the vessels. You remember that? Okay, you become alert. Because everywhere we have arteries, everywhere we have vascular system, we have cardiovascular system, cerebrovascular system, peripheral system, renovascular system. Every organ, every system depends on the vascular system. So diabetes is going to affect the vascular system. Diffuse. Diabetes doesn't affect only cardiac, only renovascular, only cerebrovascular, only liver. No. Diabetes is a diffuse disease. It's going to affect the whole system because it is going to run the vascular system. So please remember the definition of diabetes is metabolic cum vascular disease. Metabolic means high blood sugar. How it is going to affect the vascular system? It is going to damage the vascular system in the form of it leads to atherosclerosis. Thereby it leads to thrombus formation, clot formation, obstruction here anyway. So the diabetes which is uncontrolled, use the term uncontrolled, not all diabetes. Diabetes which are uncontrolled, when it becomes uncontrolled, it's likely to damage the vessels. That's why you see silent cardiac disease. Somebody says silent cardiac death, sudden death. Why? Because uncontrolled diabetes definitely is going to affect the vascular system like that. So it is something like metabolic. Why it happens? Because one is insulin is lack there, deficiency of insulin. Either there is a deficiency of insulin secretion to pancreas or insulin resistance. Suppose insulin is okay, beta cells are okay. Beta cells are okay. They don't damage the beta cells of pancreas. But the insulin resistance, what is the insulin amount in there is not having proper action. Even though you have abundant money, but you are unable to get insulin. Like that, insulin is there sometimes. But it's not going to be effective in the tissues or the organs because resistance. We are developing resistance. Why insulin? Because of overweight, obesity, lack of physical activity. Three things. Why I develop insulation? Because of my movement. Number one, even though I am lean, if I don't have any physical activity, I am going to develop that. Understood? So, insulin action, insulin secretion, as well as resistance both. So, so this is the incidents again. Not horrifying, but still let us take it as little alarming how the global, around the globe, not around the globe, look at India, our own population, definitely every complications of diabetes we see in our population, see the incidence, 1 in 5 adults with diabetes undiagnosed. You look at the 100 people, you can get the 100 people from a locality and try to check the blood sugar. You see at least 5 to 10 people are dying. Because diabetes is silent disease. How different diagnosis for diabetes by blood sugar only. Understood? So diabetes prevalence by 20 we got 784 million. The prevalence is going to be increased unless you people manage, you people try to educate the population. Otherwise, the incidence is going to be increased. So that's about the epidemiology. Second, the same specifically for India, diabetes prevalence in India is expected to reach about India by 2030, and they were going to increase. So the graph should not increase. We all of us can do something there if we mind individually. Take care of your own family relations around you. How you can how you can educate them. Otherwise, the figure is going to increase, the burden is going to increase, the complications is going to increase, and the mortality is going to increase. So we should not lose the people because of diabetes. Understood? So this is some clinical features. Actually, diabetes is a asymptomatic disease. They don't have any much symptoms. But as a student, sometimes we need to know how to identify it. Whether the individual develops polyuria, polyphagia, polycythemia means excess urination, excess thirst, excess hunger. And the common people also know this is diabetes. But this happens only already when beta cells are lost completely. So you don't wait till the patient gets these symptoms. The moment the patient says I have excess urine, excess thirst, excess hunger, already 75-80% beta cell lost. Understood? So we don't diagnose most of the time. In the screening it becomes the diabetes. So that symptoms are there only when there is a maximum beta cells are gone already destroyed. That means if these symptoms come means already advanced stage of diabetes. Weight loss, some people they come with weight loss many times. What is the reason? I don't know. Last month I was 60, now I'm 50. How come the 10 kg in a month? Rapid weight loss. See, earlier days when we were students, rapid weight loss. Last month 70, this month 50, 20 kg of weight loss in a month, which happens in HIV, AIDS patients. That was used to think some 20 years back, but I was not so common as that period. Now, somebody comes with that because HIV don't see no. Somebody comes with weight loss, young people, adult, old age, female, male, anything. Weight loss, first is look at the last one now within a month 5 to 10 kg definitely gross. Rapid and gross weight loss you see unexplained, they don't know why they don't think people come. Sir ಅವ್ರು ಹೇಳಕತ್ತಾರೆ ಭಾಳ ತೆಳ್ಳಗಾಗಿದ್ದೀನಿ ಒಂದು ತಪ್ಪು people look at them and tell you're gone down. The weight loss is there, why you are so much lean? They come to me, sir, ಎಲ್ಲರೂ ಹೇಳಕತ್ತಾರೆ weight unexplained, they don't know what to do because it's asymptomatic maintenance. Then of course diabetes, all those things. Some people directly come with diarrhea vision, that's called a diabetic retinopathy. So most of the people either they are silent or they directly come to you to your clinic to some amount of effect on the eyes, sometimes effect on the kidney, sometimes effect on the heart, sometimes directly comes to stroke. Very less. So many times it is asymptomatic, but sometimes they come with directly with complications. They have complications where already 100% beta cell is lost. The person, once the patient is on complications, he has to go on insulin. Your OHA oral antidiabetic may not help much. Understood? So that's again neuropathy. Neuropathy where the person comes with jum burning sensation of the legs. Somebody comes with jum or burning. Use burning in the field. Burning, tickling, numbness of the legs. That could be possibility of neuropathy for the diabetes. Then other central obesity, it's an Indian population. We can't blame individual or families. We Indians, as an Indian, we have central obesity or called it truncal obesity. We are predisposed for that. Nobody should be blamed for that. But still, the other things like somebody has a hypertension, then definitely every 6 months you have check for the blood sugar. Hypertension can go for diabetes, diabetes can go for hypertension. Both have a mutual relations if not well controlled. If my BP is well controlled, I don't know diabetes. If my diabetes is well controlled, I don't know BP. So how best you control diabetes hypertension? You can prevent the associated complications.
Comorbid
Otherwise,
conditions.
comorbid
Comorbid
issues
conditions.
has to be tackled. Okay. Food, many times earlier days, some 15, 20 years back, when we were students, the common cause of amputation of the leg, somebody used to lose the leg, is diabetes. Diabetes is a common cause of leg amputation because diabetic foot. What is diabetic foot is where neuropathy, vasculopathy, the foot gets gangrene, distribute they have to cut the limb. But now, sir, I don't see much because one advantage is that we have good drugs and people are educated. They come to us. We try to control the blood sugar earliest, get the blood sugar earliest normal so that we can prevent the complication. Otherwise, if you have patients are uncontrolled, not properly following, they can try to put they may go for the limb applications. So some company already I told you how uncontrolled diabetes can damage the organs, vascular system. One is called as microvascular, other is called as macro. Microvascular in the eyes we call as retinopathy. Nephropathy is the kidney involved. So why you should treat the diabetes at the end of the day? If you don't treat, what is going to happen? Understood? If there is a high blood sugar, what is going to happen? Neuropathy, nephropathy, retinopathy, ischemic heart disease, which is called as cardiovascular disease and cerebral. Ultimately, at the end of the day, all of us remember it is a vascular complications. Micro, macro, macro means retinopathy, where the person can lose. One of the common cause of blindness in the population is diabetes, uncontrolled. The common cause of nowadays we see the dialysis unit in the we have so many dialysis units in the city where some 15 years ago there was no dialysis. You can see dialysis spread around the city. They are running boom. The dialysis is happening. Why? Because the diabetic kidney disease is caused. If they are properly, the diabetes not controlled properly, they land in diabetic kidney disease and diabetic kidney failure, chronic kidney disease. They have to be on dialysis. You want the patient? No. So that's a diabetic kidney disease, diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, and diabetic vasculopathy, where the person can develop early age heart attacks. That's what we see nowadays. So diabetic retinopathy, nephropathy, and neuropathy, where I told you the person can lose the sensation of the legs. When you lose the sensation of the legs, what happens? You can't appreciate the sensation. You have a trauma, it goes unnoticed, unhealing. So one of the common cause for non-healing ulcer at the foot. Somebody comes, sir, this ulcer is not healed for 1 month. I have an ulcer. It's not healing for 1 month. What is the reason? Though is a diabetic, it is uncontrolled diabetes. Not only uncontrolled diabetes, it is already developed diabetic foot. Where the vasculopathy is there, there is a decreased blood circulation called as vasculopathy. So healing process, the high blood sugar will cause delayed wound healing. Suppose there is ulcer, it gets healed by 5 days. The person died is 50 days. Or may not heal also. So, neuropathy, then, so microvascular, correct. Microvascular is called as coronary artery disease, cardiac disease. That's what I told you many times. The patient comes with gangrene. Gangrene of the leg. What is gangrene? The whole leg turns into black. Black. They are worried. When the color changes, color of the foot changes in the black color, and then the non-healing ulcer, there is jujums and that is diabetes. That's called as peripheral artery. It's common in smokers. Just so a smoker can have a peripheral artery disease and diabetes. Many times you see the casualty, the patient lacks in stroke, paralysis. One of the common causes of stroke, young stroke, we call it dengue. Stroke in dengue is increasing. So MI in dengue is increasing. Why? Because of diabetes. So diabetes can lead to young strokes. People at the age of 30 developing stroke paralysis. Why? As a complication of cerebrovascular disease. So when people develop stroke because of the uncontrolled diet, they develop paralysis stroke. This is what we have micro, that nephropathy. As a student, we remember, keep aware of these things so that we can have in our life, so we can educate the patient that okay, this chart you can keep in front of your patient, counsel in a better way. So let us prevent these complications. Let us prevent blindness. Let us prevent amputation. Let us prevent silent heart attack. Somebody asked what is silent heart attack. It's just it doesn't have symptoms, collapse. So many videos comes there. They are sitting on the dais, something like that, and they are trying to give me suddenly they collapse. No symptoms. So many times silent heart attacks or silent MI is very common in uncontrolled diet. You mean uncontrolled diet? Diagnosis we understand we have three parameters to diagnose diabetes. One is fasting blood sugar more than 126. Postprandial blood sugar after 2 hours of the food 200 and A1C. Nowadays A1C they do A1C more than 6.5 to that. So diagnosis of diabetes and this random more than 200. So let us as a learner or student remember diabetes is labeled when you want to label individual as diabetes, not at the symptoms. Always labeling the diabetes on the blood sugar levels. What is the blood sugar level? Fasting more than 126. This is venous. What we are doing is venous, not capillary. Many times we see we do blood sugar by capillary, not good. For diagnosis purpose, always take venous blood, not capillary. If you do this, it may say it may give 300. No, never do capillary blood glucose for diagnosis. For diagnosis, you have to do venous, plasma venous. Fasting more than 126, PP more than 200, and random more than 200. So once the patient is diagnosed, okay, you are diabetic now, then the A1C is more than 9. A1C, if the result comes more than 11, it is severe uncontrolled diabetes. We tell him that, okay, more than 9 is not good, it's bad, it's called as bad control or poor control. So try to achieve A1C below 7 so that you prevent the A1C if it is processed more than 9, complications silently happens. So whenever you treat a patient with diabetes, target of A1C is arrive between 6.5 to 7. If your patient has more than 9, that means you are not properly controlling or managing the diabetes. So these are the screening individuals who are to. In my family, I have 4 members or 10 members whom I have to test the blood sugar. These are somebody who is overweight, somebody is relative, my parents have diabetic. Suppose my parents have diabetic, both the parents, father and mother have diabetic. What is the chance of diabetes developing? 70%. If my parents are having both the parents have diabetes, 60 to 70% I can develop. If one parent is having, then 40 to 50%. If both parents are not having diabetes, 30 to 40% still chances are there. So family history is very important. If my parents has, then you modify your lifestyle. Knowingly that my parents are diabetic, how best we can provide is lifestyle modification. So the physical inactivity. I see why many times the students are coming with me along in the lift. I tell them, don't go in the lift. As a students are young, go to the steps. So minor steps also. Your physical activity, the most common cause of diabetes now is not the obesity, is lack of physical activity. Even though you are lean, if you don't have any physical activity, chances are high. So lean, obesity, overweight don't matter. Involve yourself in physical activity. Understood? If you are physically inactive, you are lean or obese, chances are high. So common cause and somebody who is having some PCOD or something like that, or obesity, other things are there. So more than 35, somebody is there. Let us check the blood sugar, fasting, PP, A1C every 6 months. Affordable, not affordable, at least yearly. Every history is there. My family, I am not checking after 35 yearly, annually. The symptoms and they do that. Nowadays we do routinely blood sugar. It's very simple and cheap also. 100 rupees you can get both of these. So it is accessible, affordable. So especially, uh, so once the label and diabetes screening process, second is before you start the treatment, you label the patient diabetes. Okay, you have diabetes, mild, moderate, severe. You see to the patients. The next step what I will do is I will check the eyes, I will check the kidneys, I will check the heart, I will check the lungs. Four things. Before starting the treatment, you label, you check the things. You screen for eyes, you see for kidneys, you see for the heart, you see for the lungs. How are you going to do? Do an ECG, check the heart. Do a eye examination, check the eyes. Do the urine test, it will tell the kidney disease. Simple urine examination, you remember. Simple 50 rupees urine examination will tell you whether the individual has kidney disease or not. Understood? You want to know any kidney disease? Simple urine routine will help you. So that's we try to examine the eyes. Ophthalmologist will do kidney disease simple urine examination. Microalbumin is albumin, the urine. So check for the kidneys, check for the eyes. Food screening. See what happens is in a patient diabetes, what we tell. Remember in all diabetes, so many times you as a student, you are seeing in the COVID period, now and then go on washing your hands. Now also we have a practice of washing your hands frequently. But please remember, a diabetic individual should keep care of the foot than the hands. Say every now and then we need to see our foot for any evidence of abrasions, ulcers, anything injury. So please do advise a diabetic patient or diabetic individuals at the night before going to bed, they should put the mirror and see the foot. It is alone. If somebody like helper is there, they can just look at the foot and try to see any ulcers. So every day, a diabetic individuals look at the foot and take care of the foot than the hands, because the foot is vulnerable for injuries, non-healing, sometimes amputation. So take care of the foot. Other things like cholesterol, you have to see, check for the blood pressure, check for the ECG. I told you check for the cardiovascular. So ECG, blood pressure, cholesterol, eyes, kidneys, urine examination. Check for the nerves, peripheral nerves. You check. So try to screen for the evidence of any. Why you check? Why check all this? Because somebody has a neuropathy already. Put them on insulin. Don't go for oral anti-diabetic. Somebody has already grade 2 nephropathy, retinopathy. Go for insulin. Somebody has nephropathy. Go for insulin. So anybody diabetic with complications, always go for insulin treatment. Let it be 100 years. It is the safest. So the safest mode of treatment for complications, diabetic complications, always insulin, insulin, insulin. Please remember. Somebody has a diabetic kidney disease already, don't go for tablets. Always insulin. Understood? So insulin always safe. This is how you try to address. One is address the blood sugar, address the BP, address the cholesterol, and try to look at the kidneys. And these are the 5 goals we have. So when you try to treat the patient, that see that the blood sugar is normal all the time. All the time we see the blood sugar is near normal. Like for example, fasting less than 130, postpartum less than 180, and emergency below 7. So put up the target to the patient. I want